Welcome to the In the Silence podcast. I'm your host, Sandra Payne. As an RN and holistic wellness coach working with nurses, I am uniquely positioned to hear the struggles, the deep passions, and the stories of nurses, our silent heroes. Many nurses suffer with burnout, depression, anxiety, PTSD, substance abuse, and suicidality, and they do so in silence. Nurses are the ones we turn to for help when we need it the most, and this is a heavy burden for them to carry. This burden, the pervasive bullying and unsupportive culture of our healthcare system, means many nurses have lost their voice. These are their stories. Welcome back for another episode of the In the Silence podcast. I'm Sandra Payne, your host, and I am here today with Jennifer Kirk. She is a registered nurse and the founder of Dragonfly Meadows, a retreat space offering empowering and inspiring equine facilitated learning workshops for other registered nurses, LPN'S, and other professional caregivers since 2014. Jennifer is a practicing RN with 17 years of experience. As an RN who has worked the majority of her career in critical care, she knows all too well the challenges that nurses face. Throughout her career, she has experienced and witnessed firsthand the changes in the healthcare system that have impacted nurses in such huge ways. We're talking about the increased workload, low morale, high turnover rates, moral injury, compassion fatigue, vicarious trauma, and poor work-life balance, just to name a few. Jennifer took her first workshop in equine facilitated learning in 2012 and wanted to find a way to help nurses understand the stressors of their careers. A magazine article on compassion fatigue popped up and was a big aha moment for her, and she's been offering these workshops for nurses since then. Welcome to the show, Jennifer. I'm so excited to dive into everything that we have chatted about and so much more. I want to say one thing first is I love the name of your space, Dragonfly Meadows. I have a real affinity for dragonflies. I don't know why, but they flock to me. And you probably know why, but I just wanted to put that out there because it definitely sparks something. But nonetheless, welcome to the show, Jennifer.
Thanks so much, Sandra. I'm really excited to be here.
Yes. So let's start off, and you can tell us a little bit about your story as a nurse, and just dig in a little bit deeper as to kind of what's brought you here today, and the backstory of Jennifer as a nurse.
I started nursing in about 2002 on thoracic surgery, and my background was really holistic medicine. So I studied massage therapy, acupuncture, craniosacral therapy, all those things. And I had this vision and this idea that nursing and holistic medicine would kind of come together. And I've been really disappointed in that. And then I made the move from Calgary up to Red Deer, and I ended up getting my first horse at age 40. And so anybody that enters the horse world at age 40 goes through some big transformations in learning. And I took my first workshop on equine facilitated learning in 2012. And it was really an eye-opener for me. And I began to understand how my work baggage really impacted my horses. So I would come home from working in the emergency department in Alberta, in Red Deer, and I would have all this baggage, and I'd still be carrying around the interaction from the first patient of the day, and not being able to get the patients to the floor, patients waiting in the waiting room getting upset, not getting my break, and the horses would be standing at the gate waiting for me. And when I went down to the gate, they would just scatter, right? So horses are very tuned to energy. So they're saying, hey, we're here for you, but don't bring that energy in here. So through the equine facilitated learning, I learned that I really needed to deal with the stuff from work, deal with the stress and the anger and the frustration and the hostility and all the emotions that we tend to bring home with us. And then through the equine facilitated learning, I kept thinking, how can I bring this to nurses? And then there was a magazine article, like you mentioned, and it was on compassion fatigue. And then it was a huge aha moment for me. I remember reading it down by room 8 in the ICU, and it was this is it. This is what's wrong with me. I have compassion fatigue, right? And all the stuff, all the things. I had burnout, I had compassion fatigue, worked all the way through H1N1 in ICU. So a little bit of secondary traumatic stress there as well. So the horses have brought me forward in so many ways, just with learning how to deal with stress. I didn't know what heart math was. I didn't really know about grounding as well as I thought I did, with my earlier career of being into massage therapy and the holistic pieces, right? And the horses are very authentic, and they don't mirror you, they react to you, right? So you need to dump your garbage before you go into the pasture. So that's what I learned, right? And so now I come home from work and it's like I kind of assess myself. Am I in a space where I want to be around the horses, right? Do the horses want to be around me when I'm in this frame of mind? So
Yeah.
Does that make sense?
Oh my gosh. Yeah. And I'm thinking of like, I mean, I have a number of clients, actually, particularly from Alberta, who have their own horses or who work with horses. Actually, there's some here in BC too, but, nonetheless, they work with horses, and I have this real curiosity about them. I've never been like a horse person. However, I did have a shaman in training did a spirit animal journey with me and told me that my primary spirit animal is a horse. And so I was a little bit, I mean, I've been told I have a horse-shaped face by mean children in my life, but
I don't think that's true.
that aside, I was really intrigued by it. And my parents, had just bought horses and they were living on Vancouver Island. And I am nervous with them. And, but I also thought, like, I've heard a lot about how therapeutic they are, and I've seen, on TV different programs that work with troubled youth, and they bring them in, with the horses. And now hearing your perspective of saying, like, you have to dump your garbage before you can, be with the horses. I mean, it kind of makes sense, but maybe you can tell me a little bit more, because I'm sure, I mean, I'm super interested. I'm sure people listening are also super interested, just about, how equine facilitated learning works and how you integrate it with nurses, like how you provide that offering for nurses.
Sure. So I look at a couple different things in the workshops. The first thing I look at is mindfulness. There's one exercise we do with the horses on mindfulness. The second thing we look at is boundaries. Boundaries are huge for nurses. Nurses have terrible boundaries. Terrible. And we are programmed to be that way, right? Terrible boundaries. And then we look at, like, are we making it difficult for others to care for us, right? Is someone offering to care for you and you kind of like not letting them care for you? And then we look at, like, a takeaway, like, what's a goal that you're taking away from the workshop? So I kind of incorporate the nursing process into it. So I'll do a little bit of a lecture on, we'll say, how has your worldview changed, or how do you think you've changed being a nurse? And then there's interaction with the horse. And then there is some reflective writing, and then there's group discussion. So the exercise on boundaries is truth telling. So someone can think that they have really great boundaries until I put them with my horses. And I don't interpret the nurse's experience with the horses. They interpret it for themselves. It's not up to me to interpret what you felt with my horse. Your experience is your experience. So it's really interesting with one horse, my little Tinker horse. He's a gypsy vanner. He's very sensitive. And so if you're very clear and firm in your boundaries, he will listen to you and do what you want. So one of the exercises is they walk the horse around the arena, then draw a line in the sand, then step out in front of the horse and back up. And the horse has to stay behind the line, right? So if you have good boundaries, Tinker will stay behind the line. But if your boundaries are, if you don't really mean it, or you're a little bit uncertain about your boundaries, he will kind of step into you and he'll just kind of want to stand next to you and maybe nuzzle on you a little bit. Right? And it's really fascinating to see nurses have these experiences. And then you might have a nurse that sets the line in the sand and he's like 6 feet behind the line. Right? So, and it's really interesting that the experience everybody has, like, yeah, I really don't have good boundaries, or yeah, maybe I just say no a little bit too loudly, so it's really interesting. And then we have a talk about how hard it is to say no to, like, shift changes. How hard is it to say no to working overtime? How hard is it to say no to your family members when they want to do something after you get home from work? Right?
Yeah. I mean, boundaries apply to every aspect of life. And I definitely agree, as a general statement, I'm sure that I know that there are nurses who do have good boundaries, and have worked really hard to create those, because you're right, we're conditioned to not.
Yeah.
We are guilted and shamed if we have
Yeah.
boundaries, right?
Yeah.
Because what makes you so good that you can turn down shifts? Like,
Yeah.
yeah, meanwhile everyone's killing themselves. But that again is, tied to that badge of honor that we wear,
Hmm.
for being burnt out and for being the one who gives and does it all. But we can totally talk about that later too. But tell me a little bit more about how the horses and the therapies that you have, learned but also practiced, I'm certain, with yourself. How did they help you as you were navigating the challenges of, your nursing career?
So I learned to like do a lot of the heart focused breathing, grounding, stretching. There's just kind of different exercises that you can do as you're aware. I don't do yoga because my elbows can't take it, but if I could, I would. And it's just basically for me, as I do a lot of the heart math breathing, heart focused breathing, I will take time out. Like if there's a difficult patient or a difficult situation, I will step away. Like I'll take little micro breaks. You just need that sometimes to get through your day. And like I said, the most important thing is to dump your baggage before you interact. So it's like answering the telephone, right? Whenever you answer the telephone at work, it's scary because you don't know what's going to be on the other end, right?
Mm-hmm.
Is it going to be someone's looking for a bed, you don't have one, the patient's not discharged yet, angry family member? Do you know what I mean? Like,
Got
it's
nurse
really
being
hard.
pulled.
The nurse
Yeah.
being redeployed, right?
Yeah.
You don't know what's going to happen. So I really try to incorporate the heart focused breathing throughout the day. And then sometimes the horses don't want to spend time with me, right? They might want to hang out with each other. So if I go down to the field, and try and engage with them and they say no, it's okay. Like it is okay, maybe not today. And sometimes they're standing at the gate going, hey, let's do something. So it's really reciprocal. And there's a lot of different theories and philosophies when it comes to horsemanship. And that's a whole separate like podcast. But for me, all the interactions I do with the horses are on the ground. There's no riding, brushing, leading, just being in the moment with them. Some nurses have had some pretty profound experiences just standing next to the horses.
Mm-hmm.
Yeah.
Mm-hmm. Yeah. Yeah, thank you. And I wonder if we could even just backtrack a little bit and spend a little bit more time talking about some of the challenges that you did face as a nurse. We kind of started and then we dove into
Yeah,
the equine therapy. I mean, it's just
sure.
it's so fascinating. It's such a new and very, I don't know very much about it,
Mhm.
about that, type of therapy. So it's super interesting to me. But I would like to kind of scale back and hear a little bit more about your story of how you were struggling as a nurse.
Sure. Was working. One of the ways I struggled is I was working in the emergency department and I was being bullied by the manager, and it was really difficult and challenging. And I felt really powerless because she wanted me to do something that I didn't feel was safe. And at the time, there wasn't as many jobs around as there is now. And my colleagues, some of them were also bullied by this particular manager to do things that were not necessarily safe. And it was a really stressful department. There was a lot of lateral conflict, I guess, and you just be overworked, overwhelmed, too many patients, no breaks, you don't get to eat, disagreements with the doctors, the whole package. Like it's everything. Delays in getting medications from pharmacy was, the whole thing adds up to stress, right? Like, and it just snowballs. Like you get to work and you get reports, and report isn't what you see isn't what you were told about. And you're cleaning the stretcher yourself to get another patient in because the waiting room's 30 people deep.
Mm-hmm.
Yeah.
Yeah. Yeah.
There's a accident on the highway. Your flow nurse is pulled to the trauma room. So it's all those things that add up, and it's really hard when you cannot give good care.
Mm-hmm. Yeah.
Right? We
Yeah.
can't give the care that we are trained to give. You
No,
can't
we
do
really
it,
can't.
right?
No. And that's where that whole conversation around moral distress, which
Yeah.
for me, I'll tell you, in my, this was even after I discovered so many tools and resources and had been already navigating my own healing,
Mhm.
for my mental health and my emotional health. But there was a video put out about moral injury, and that was a huge aha for me, because it gave it a name. It gave it like a real, it made it real. And
Yeah.
what I have realized since then is that it is probably the most common cause of burnout,
Mhm.
depression, apathy, overwhelm, exhaustion in nursing, is because we're not able to give the care that we know is going to be the most benefit to our patients. It's our standards, it's our values,
Mhm.
it's everything, this internal pull and struggle for us, because we are unable and unsupported to do the work that we want to do. And so, I mean, as you're describing this emergency room, it's just like
Mhm.
I get this vision of like it just piles, right? Like
Mhm.
it just piles up, and everything just, you probably walk in the door and there's like this instant flood of all of those hormones and things that happen inside of us when we're stressed. And we all know that isn't good for us. Like we know that, but we also continue to walk into it. So
Mhm.
I'm curious, like what did you notice in your life that were telling you that this was not going well, that this is was becoming a real problem for you?
Was probably drinking a little bit too much, because I would come home and have a drink probably like right as soon as I got through the door. And then, the biggest impact that I realized was the interaction with the horses. That kind of really told me a lot once I started learning more about the equine facilitated learning. I wasn't eating very well. I was losing weight and just really not taking good care of myself. Like, um, and my relationship with my husband at the time really suffered a lot, right? Because you literally have nothing to give when you get home,
Mhm.
right? Like, and we do tend to be, nurses tend to be, well, let's put it this way. One physician I talked to said that they felt sorry for children who had nurses as parents, because that physician felt that those children did not get proper health care because they never got to go to the hospital, right? So we tend to minimize our family's needs, children's needs. I've had nurses come to my workshop. One nurse, her son had a broken arm for a week before she took him in for an x-ray. Another nurse, her husband had pericarditis before she let him go to the emergency department for 5 days.
Mm.
Do you know what I mean? Like, so we don't realize how we are impacted by what we do,
Mhm. Yeah.
right?
Yeah.
And I agree with you, the moral injury is huge. And moral injury just isn't the big things, it's all the little moral injuries that happen, right? Like discharging a woman that you know is a victim of domestic violence back to that home.
Mhm.
Discharging a child you know is going back to a home that doesn't have groceries.
Mhm.
Discharging a frail elderly patient home when you know they're going to be back the next day because they're going to fall,
Yeah.
right? All those little things add up to the moral injury. And then the big moral injury things are like providing care for people that don't want care. Like, for
Mhm.
example, a code on a patient that doesn't want to be coded,
Yeah.
giving blood products to people that don't want blood products.
Mhm.
Um, there's all kinds of huge moral injury issue. And I do think that it's probably the biggest factor contributing to nursing burnout, especially during the pandemic.
Mhm. Yeah. Yeah, I feel like this is, it's been a long-standing issue. I mean, because I haven't worked during the pandemic and I experienced it. So it's like this has been a reality of nursing and healthcare for probably ever. And but this is like pushed everything to the edge, right?
Mhm.
It's pushed because now we are in like real crisis in healthcare with as far as staffing numbers and support. There's so many issues that are happening, that the morale, the division within the
Mhm.
profession, and just it's like we use this term, which is only nurses will get it, but like we often said like circling the drain, right? when a
Oh yeah,
patient's when a
yeah,
patient's really going downhill.
yeah,
And I feel like nurses for the most
yeah,
part right now are really circling the drain, and it's like how much more can we take, how
yeah.
much longer can we hold on, and keep this all together, because like there are nurses dropping off in huge amounts, on
Mm.
daily on either medical leaves or leaving altogether because they're saying like I can't do this anymore. Tell me a little bit more about your learnings about compassion fatigue and vicarious trauma and those kinds of pieces that we sort of mentioned in the beginning, but I'd like to dive into them a little bit more.
Sure. So most nurses don't actually know what compassion fatigue is, and they don't teach you how to survive your nursing career in nursing school. So I never learned about compassion fatigue. I never learned about moral injury or moral distress. I didn't learn about any of those things. And so you kind of stumble along and you don't know what's wrong with you. That's what I find is the nurses that come to me, they know something's wrong, but they don't know what it is because they just don't know. And then, you know, in the nursing profession, as you know, there's a great reluctance for mental health support. I have a mental health practitioner I see, and I've been seeing her off and on for 10 years when I need to see her. And it's great. It's always great to know that someone's there. And there is a certain group in nursing that kind of poo-poo mental health and nursing, but it's time that we actually acknowledge the moral distress, compassion fatigue, and all the contributing factors to it, which is essentially the system. So for me, the biggest, when I realized I had a vicarious trauma is a girlfriend and I, we started selling purses at the local farmers market, and we both worked in the emergency department. And so I remember the first morning being there, there was probably 1,000 people there. And I was like, I don't have to ask anybody if they moved their bowels today or if they peed. Yeah, like I was totally like, I realized there's something wrong like with me because I just wasn't used to seeing that many healthy people because I just pretty much worked and went home and worked and went home. And I didn't go out and I didn't socialize a lot. Yeah, so I'm pretty much an introvert. And yeah, so I was really shocked. And I still can feel those feelings like, wow, seeing all these healthy people out there in the world. I honestly didn't think they existed.
Wow. Hey. Yeah. I mean, I can relate to that when I worked in the NICU, for, you know, you start to think that like all babies get sick. Like,
Yeah.
Consciously, you know, they're only a small percentage, but you know, when I was pregnant with my first child, it was like, you know, the flood of every possible thing that could go wrong. And you think that all those things are going to happen. You know, there's like the flip of what you're talking about, how we, you know, as nurses don't let our family members go and get care because we're like, you know, it's not bad enough yet, right? Like we have this standard that, but then there's the other flip of that where I think it could be even a different perspective of like almost like hyper, you know, thinking that everything is wrong. I think it's called like a hypochondriac, but I don't like to label things. But you know, it's like where you think everything is wrong because you've been exposed to so much disease and sickness and suffering and so much awful just situations that people can go through. And so, you know, the slightest little tinge and it's like, oh my God, I'm having a heart attack, or like, oh my God, this is cancer, I have a lump here, right? So it's like, we also have that side of it, which is, I think, also symptoms of that vicarious trauma, right? Where we just are in that hyper kind of vigilant state where everything could be a problem. Yeah, tell me a little bit more. Like, I really want to dive into this compassion fatigue because you are so accurate in that they do not prepare us for any of this in nursing school. I have heard like little whispers of some things that have changed in different programs, but so possibly it's on the horizon. I certainly hope so. But you know, but they don't prepare us for it. They don't tell us about burnout. They don't tell us about compassion fatigue or trauma. They don't tell us about moral distress. We go into this, you know, like I just posted this. It was a comedy skit. Did you watch it? Yeah.
Yeah, it's awesome. Yeah.
She's skipping across the stage as a new nurse, right? And she's all excited and she's got like all her pens and everything. Like, you know, we come into it with this bright-eyed perspective, right? Yeah, I mean, it was me too. Yeah, like you're excited. I mean, we just went through freaking hell to get here, and we're finally here, and we're excited. And then we work in this for you know, sometimes not even a year, and nurses are feeling it, like especially right now. Yeah.
6 months.
Yeah. So what kind of signs, you know, you mentioned a little bit about what the impact that you were noticing in your life. What kind of other signs should people be looking out for, like when it comes to this compassion fatigue and, you know, all those other pieces we've talked about?
Well, so a lot of the girls that come to my workshop, so here in Nova Scotia, a full-time nurse will do 2 days and 2 nights. So some of the younger nurses, I mean, the new ones, the dolphins, I guess it was, right? Yeah, that was the skit. Yeah, so they'll get off the morning of their second night and start binge drinking to manage with the stressors that happened to them for the 4 days before. So they'll binge drink for a couple of days and then they will be sober for a day and go back to work. That's poor coping. A lot of them don't sleep. Like nurses, even across the board, don't sleep. Hypervigilance is huge, right? Like And that falls into, I don't want that to happen to me. And that falls into the, I don't want to make a mistake part, right? And like the conversation we had the other day about how the system sets nurses up to make mistakes, right? And a lot of nurses don't really realize that, like the system sets you up, right? Like, or not, the system doesn't intentionally set you up, but the system is set up, right? So that you make mistakes, you don't get your breaks, you don't get to eat. A lot of the nurses will have lots of physical complaints, somatic complaints, heartburn, fatigue, anxiety, depression. I think what else has come up. A lot of them, the younger ones, they always go to the bathroom with a friend when they go to the bars. They don't want one particular nurse that worked long-term care. She's like, I don't want that to happen to me. And she means being a resident in a long-term care facility. Right? The golden years aren't so golden.
Yeah, it creates a ton of fear, right? In so many different ways. And I mean, I see the same things when I'm, meeting nurses for the first time and we're getting to know each other and talking about what's happening. And it's a lot of the same things, like the biggest, probably I would say, named symptom that nurses bring is anxiety and depression. And I think because there is quite a strong understanding of those, and they are more commonly used terms, but I don't think we really fully understand yet. I'm not saying everyone, but the depths to what this amount of stress can impact us, right? On every level, on a psychological level, on an emotional level, on a physical level, on a spiritual level, on a relational level. Like, it affects everything. And it may not right away, but it's a very slippery slope. And I kind of think of it, it's a little bit insidious, right? And because it creeps in and we're in this culture that normalizes it. So we don't think it's anything, right? It's like, well, it's not that bad, right? Like, oh, it's not that bad. And we literally, some nurses say, yet it's not that bad yet. Like, so we know it's going to get worse, but yet we're not doing anything
about it.
To make it better. I wanted to dig into this too, this conversation that we did have a couple days ago about errors and how our system, as you were saying, it's kind of set up to facilitate us to make errors. And I know it's not intentionally set up, but it's not supportive of us to ensure that we are in a safe practicing environment, that we can minimize errors, right? Because this is a symptom, honestly. It's a symptom of burnout, it's a symptom of all the things, increased errors. And I know we were talking, and I was a absolutely terrible night shift nurse. I did not do well. I had brutal restless legs. I could stay awake, but it was really painful for my body to be awake. And I was lazy. I was lazy with things. Like I could own it. I would write down numbers from a monitor that I hadn't actually, I was lazy because I was dying inside. And I made a lot of errors. All of my med errors were done on night shifts. And I want to talk a little bit more about that, because I know you had an error in your career, and possibly more than one. So
definitely more than one.
yeah. So tell us a little bit about that experience, and like how it all evolved and how it impacted you.
Sure. One thing I just want to mention, going back to what you just said. So most nurses that are diagnosed with anxiety and depression, it's actually something else, right? So they'll go to the family doctors with these feelings, and they'll get diagnosed with anxiety and depression, but sometimes it's something else like PTSD. So, if there's anybody that's out there that's listening that your doctor's diagnosed you with anxiety and depression, you probably need to seek further consultation and investigation. That's been kind of what my experience is.
For sure. And more than just a pill to treat it like that. That's not an effective it's not an effective intervention for people who are suffering in that kind of way, because it's not just I'm just anxious. It's never just that. There's so many more pieces there that require an in-depth look. For sure.
So med errors. Wow. Like, have I seen a lot? And I made one and med error, and I was working in Emerge, and I gave a little old man that fell at church and got some compression fractures in his spine. I ended up giving him a little bit too much morphine, and I had gone home. And before the count was done, which is a no-no, but that's kind of how the department rolled at the time. And I got a phone call, and it was like, did you give such and such, such and such? And because the morphine counts out, and I was like, oh my gosh, I must have done it. Because at that time we didn't double check our meds kind of like we do now. And I was like, I must have done it. And I was completely devastated, crying. I was down in the horse pasture, actually, crying, fetal position in the horse pasture, thinking I'm going to lose my nursing license. I felt truly horrific, like horrific. And I was, asking if the patient was okay, and he was totally fine. And so there's a couple things that led to that. Number one is the med cart was in the middle of all the nursing stations in that particular emergency department, and there had been some catastrophic med errors made there before. And I think I was interrupted. The secretary would interrupt you, the doctor would interrupt you, your nursing partner would interrupt you when you were at this particular station. So anyways, I did it. I gave too much morphine. So I had gone to ICU, I think it was a couple days after that, and that was something that was in transition at the time. And I still never got over it. I'm still not really over it. And it's been years. And so about a year later, I was back down in the emergency department speaking to the same manager who was down there, and the pharmacist was in there. And she brought up this med error that I had made. And I said, I said I was still really distraught about it and upset about it. And the pharmacist said, well, I followed that patient all the way through his hospital stay. And the only time he had good pain control is when he was with you. And I said, I wish you would have told me that a year ago.
Mm-hmm. Yeah, I remember you sharing that part, and I was thinking, like, why don't they, right? Like, the learning aspect, right? I mean, of course, it doesn't always have a positive spin to the error,
it doesn't,
right?
No.
But there is, it was spurring the conversation around the different errors that I had made as well. And it just, the big part that really stood out for me as I was reflecting on that later on is like how in the midst of such a traumatic experience of making an error, right, of potentially harming someone, not intentionally, of course, but still potentially harming another human being, and in my case it was an infant, and the shame and the fear and the guilt and just the oh my God, I'm not cut out for this. Like, they were right. I shouldn't have never become a nurse. Like,
everything.
All the things, right? All the mind mess just like floods to the surface. All those trauma responses flood to the surface. And what I was met with was anything but compassion, anything but empathy and support. It was like, just, you know what, here she is, she's down. Let's kick her while she's down. And that was, that was a really significant experience of my nursing career too, because I could relive that moment. It's still very fresh in my body, as well as many others, as I'm sure it is for you and everyone listening too. But it just, I think we need to have a different culture around this. It's like we talk about a lot of things in nursing, bullying being one of them. We talk about how it's not allowed, and it's, we have policies around what we would do, but there's no responsibility. There's no accountability, right? When I was in that moment, I mean, I was sobbing in the break room thinking I potentially just like gave this kid brain damage, and to have the manager come in and be like, how long you think you're going to be? Like, I mean, I was devastated, and like that is harmful to people, and those people need to be held accountable for that kind of behavior, right? And those kinds of actions. But I also have the perspective too of like, hurt people. So, but I didn't have that at the time. At the time, I was just a mess. I was a puddle. And then I was furious afterwards, right? Like, how dare they treat me like that? And it was just, another thing to put on the pile of what I was experiencing there, working in that critical care environment. But yeah.
So I think all nurses need mentors, right? They need someone that they can call and talk to about it. Because I know I have a mentor, and she is also a good friend. And I called her and I was bawling my eyes out and telling her what happened. And she's like, oh, Jen, that's nothing. When I first started nursing, I gave my patient is sleeping pill 3 times in one day, and I couldn't figure out why I was so sleepy. Right.
I mean, it's not funny, but
it's not funny, but you know what? It lifted the weight off my shoulders instantaneously. Right. Like, and I felt immediately better because I wasn't the only one. And that's why I think we need to share these stories. I've given a patient an ordered dose of hydralazine that the physician orders, and his pressure drops like he was pre-arrest, right? It is going to happen that you're going to give a medication to someone that they are not going to react well with. Right. Yeah. I gave a lady morphine in the emergency department, and she puked and she puked and she threw up, and she had to spend the night. She was, because I gave her the morphine, right? I felt terrible. Yeah. That I caused her to have more agony than what she came in with, right? Like, so it's hard. Like, and I think we all need to be a little bit more supportive of each other in those situations. Then it needs to be a little bit more open and less shaming, right?
Yeah, totally. And I mean, it just kind of illustrates the expectations that are put on nurses, right? Like we're not, and this is not to say anything negative about bagging groceries, but we're not bagging groceries. These are human lives that we are responsible for. And the expectations, even when we are fully staffed, fully supported, the expectations are still really, the bar is high. These are human lives we are dealing with. And right now it's like you're operating with, half a load kind of thing. Like you don't have the tools and the support and the time and the resources and everything that you need to do the care to this extreme expectation that is out there, like to be healing human beings. And there's so much, my heart is just when I think about what nurses are going through right now, and how scary it has got to be, but then also the impact of that constant fear of walking in, being in a shift for 12, sometimes 18 more hours, where you're in that constant stress mode, that constant fight and flight, and the impact that does on your entire system is just, it's devastating. It is devastating. Yeah. Tell me a little bit more about mentoring, because I think that is a significant project that really should evolve. I know there are programs, throughout Canada for sure, mentoring programs or peer support programs, and knowing that you have a place to turn. The program that I offer as well is like, it's similar. It's a peer support, right? And so there's a lot of learning, a lot of resources and tools that we learn throughout the program. But a big aspect of it is the group component, where the nurses are together. They are sharing their experiences. They are witnessing each other. There's this sense of like camaraderie, right? And also it ends that isolated feeling of like, I'm the only one that's gone through this. I'm the only one that's suffering right now. So tell me what are your thoughts about mentoring, and how could we make this sort of a more common practice, if you have some thoughts on that?
I think, like, for me, the mentoring part isn't having a mentor to necessarily teach you how to do your job. I mean, I think that's a really important part, but I think every nurse, especially a new nurse, needs a mentor that's separate from where they're at. That's not affiliated with that particular work environment, and to be there more for emotional and psychological support, and to share their experiences. Like, yes, I was bullied back in this unit, and this is what I did, and this is how I handled it, or this is the career move I made. I left this job and I went into public health, and then I migrated up, or I went wherever and it made me happy, or I did this volunteer position overseas for a few weeks. Just someone more there for like emotional support and career guidance, right? And I feel really bad for nurses who are just kind of resigned to work in the emergency. I'm a lifer here right after they get out of school. I think that's just sad, because there's more to it, right? Like, it's like Jane Van Burnt, right? You had on. Yeah. It's like, she didn't want to work with a bunch of burned out nurses at the bedside. Right. Good for her. Like, she found her way. Like, so, maybe some people need some nudging. I know I've nudged some people that didn't want to leave positions that they were in, but their term had ended up, and I've nudged them to go work in other areas, and it's worked out really well. So it's, I think you just need someone there to kind of take the blinders off and kind of look at the opportunities that can be out there for you. Yeah. Right. Yeah. The nurse practitioner program, I think it's great. I think it's much needed. I'm sure there's going to be a lot of the same issues that we face, at the bedside, but at least they're, taking nursing forward a little bit more in certain areas of Canada anyway.
Mm-hmm. I think there is a lot of nurses right now who are kind of at that point
Oh, yeah.
where they are considering, is this worth it?
Yeah.
Is it worth it to stick this out? And what's the cost if I do?
Yeah.
So I think there is definitely a conversation to be had there.
Mm-hmm.
It's definitely one I want to have, because I left. I mean,
Yeah.
I left. Because I couldn't do it.
Yeah.
Everything inside of me was saying that this is not the right choice. This is not the place for you. This is
Yeah.
not good for you. But making that choice and leaving was extremely difficult and scary. And there still is a grief process. And we were talking.
Mm-hmm.
All right, I don't think it was us. Actually, I was talking to another nurse and who left nursing also, and how we we're hanging on to our license, and we're hanging on to these pieces, even though we know we're not going back, because we know we it's not for us, and we've moved in a different direction.
Mm-hmm.
But there is a whole process to that, and it's not for me or for anyone to tell anybody what the best
Mm-hmm.
choice is for them, right? But I think you need to really take that time to navigate what is the best choice for me. And sometimes it means leaving,
Mm-hmm.
sometimes it does. But I also want to mention, just what you just said, is that there's so many opportunities
Oh,
as a
tons,
nurse, right? Like
tons,
it
tons.
doesn't mean we have to leave nursing
Yeah.
altogether. Like there is so many roles that you can take as a nurse, but I do see so much of like this perspective of like, oh, I've only ever worked in long-term care. How am I
Yeah.
ever going to do? Well, you started in long-term care and you
Yeah.
survived. Like
I see that a lot too. I see that
yeah.
so much. It's like, oh, I've worked long-term care and I can't make a change, or they worked emergency for 18 years and they're trying to make a change, right? And it's
Mm-hmm.
like, it's stressful and it's hard, and it's the fears about learning something new and being a failure and having
Yeah.
shame, and it's like, it's amazing how you carry all that stuff with you.
Mm-hmm.
Right?
And it's also really amazing to work through that stuff. So
Yeah.
I kind of if you read what I wrote this morning, it was like talking about the edge, and I feel
Yeah.
like the edge is an opportunity,
Yeah.
right? Like if we make a choice to do something different and face all of that fear, all of that shame, with support, because nobody wants to face
Yeah.
that kind of stuff, and
Yeah.
nobody should face it alone. But we open up and we expand to like so much potential and possibility in our life. There is so many
Oh,
opportunities,
I
but
know.
there is this sense of like, how can I leave this? I know when I first left the NICU, to I wasn't supported either.
Mm.
Like the staff on that unit were like, oh, you're going to be so bored where you go, or like, oh, that's not even real, nursing, right?
Yeah.
Like
Yeah.
those kinds of
Yeah.
comments. So
Yeah.
not supportive, and like definitely not inspiring for me to go. And so I'm still baffled to this day how I was able to find the strength to leave.
Yeah.
In the shame spiral that I was sucked into
Yeah.
in that time. But yet I did. But I think probably a lot of nurses go through something very similar too. It's like,
Mhm.
first of all, how can I face all of those things? I'm not good enough. I can't
Mhm.
learn new skills. I'm too old. I'm this kind of nurse. Like we label ourselves like we don't have
Mhm.
this expanded potential. But then there's also this like, this shame and guilt too of leaving
Mhm.
the people who you've been working with. I mean, there's so many factors really that come into play. It's very layered. So I'm curious if you could tell us, just, in a nutshell, kind of like what have been the most impactful tools or resources or practices or supports that you have found that have helped you to create more balance in your career, and to create a much more healthier well-being, mentally, emotionally, physically, spiritually. I know that's a big loaded question, but if you could just offer what have been the most beneficial healing, I would say, for you.
Well, anybody out there that's listening that has horses, is I do a lot of thinking and problem solving when I'm cleaning stalls. And I also practice heart math. I meditate very regularly. I try to eat well, although Doritos are my emergency kind of go-to snack food. I try and eat well. I have a mentor as well for nursing, and I have a mentor for my equine practice. And I also have a nurse mentor that I had mentioned before. So I have different people that I reach out to, and I have of course, my mental health professional, if I didn't say that already. So I know when I need to call her and book in, and just to see how things are going. And I work with a really great crew. I finally have a job where we're all on the same page. We can all give really good care. I have all the resources I need to do my job, and it's really nice. And I work in recovery room now, and that's where old nurses go to die. So I've been told. But that's okay. I'm okay with that. That's fine. I'm good. And I think that, you have to realize how your job impacts your family as well. I think that's really important. Like, are you bringing all that stuff home with you? Do you have enough energy to spend some time with your husband? Can you listen to what he needs, his concerns? Because in my experience, they can't always hear our stories, and we need to have someone to hear our stories, right? Yeah.
Yeah.
I think mentorship's probably the biggest part, for sure.
Yeah, I'm feeling like it really is. We need to have somebody to turn to, or a group of somebody's to turn to. And I reflect on this all the time, and thinking of the workshops I've done, and the main thing as far as feedback I get is that it's so good to be in connection with someone who's a nurse, and who gets it, right? Who's been there, who understands the ins and outs and what it really is like, the pressure, and the expectations and the shame and all of it, the trauma that we experience. And so there's a real sense of relief, I think, for other nurses when they can access a practitioner who is skilled and has resources to help them, such as yourself and myself. And there's many others who are doing this work, who are caring for the care providers and nursing the nurses, if you will. But there is definitely a safety in it, because nobody wants to try to explain what it's like to be a nurse, because I'm not sure you accurately can. Like, I don't, if you're like drowning and on fire at the same time, like that might be a good explanation, but you don't, unless you have that lived experience, it's really hard for people to understand. So I think having a mentor or a care provider that is familiar with nursing and gets it, I think is really super helpful for people as they navigate whatever challenges they're going through.
Yeah, I did an online search looking for a psychologist that specialized in nurses, and I couldn't find one. So, I mean, that would be a huge market right there, right?
Yeah.
And it's interesting, like through my workshops, we all share the same thing. We all have anxiety. Who hasn't sat that bolt upright in bed at 2:00 in the morning and go, I didn't chart that? Who hasn't done that, right? Right?
Yeah.
Like, who has not?
I was just asked yesterday, do you ever have dreams about it? And I was like, not good dreams. Like, I still have those, not very often, but I have, where I've like woken up like, oh my God, I forgot to do, oh my God, I left my shift. Oh my God, I didn't even touch this baby the whole shift. Like the nurse is going to come on. I haven't changed just panic over really, they weren't significant things, but that's the level of stress and trauma that's happening on an ongoing basis. So we need to as a culture, but also as individuals, recognize that this is the reality and that it's not sustainable, that each of us, it needs to become our personal responsibility, that we look for care, that we look for support, that we look for tools and ways that we can navigate this, because I really don't think it's sustainable. I would wager to say there's probably a handful that are going to ride the wave and will be will be fine to some degree, but for the vast majority, there's going to be a significant cost to them and their well-being. And so I really think that there is a huge need for the work that you and I are doing for nurses. And I just really, really hope that nurses will hear this and will hear our message and will hear that we are that we are here and we care and we want to help, and we want to, walk beside them as they figure this out. And so tell us, how can nurses find you and the work that you do?
Sure. Oh, there's one more thing I just wanted to add.
Please.
You need to have some sort of ritual to end your day, to leave your work at work, right? Whether you drive around the block 3 times or you sit in the car for 5 minutes and take a mindfulness break, you have to have something that breaks up somewhere of all the stuff that happens to you during the day by the time you enter your house. You need to have some way to unload all of that stuff, because you don't want to bring that energy into your house and into your family. And a lot of nurses I work with are younger nurses that have young kids, so you don't want to bring that to your kids, right? So meditate for 5 minutes, do some stretching. I used to throw I'd save up all my glass stuff, and I'd have a corner in the garage and I'd smash glass, depending on how bad the day was. Like, you just have to find a way or find a ritual or something that's going to work for you. Sit with some essential oils, work on some pressure points, but I think it's really important that you find a way to unload the challenges of the day.
I so agree. I'm so glad that you mentioned that too. I was introduced to it as kind of like bookends to your day, right? So, starting it off with an intention or a practice that just kind of sets you up with this, like, it's going to be a good day, right? Like, maybe, I my routine when I come into my office, like, turn on my lamp, turn on my diffuser, like, smell some oils, I do some affirmations. I'm setting myself up for the day. End of the day, I shake it off. I literally will shake for a few minutes. Yeah. I smudge my room. I do some more affirmations, some deep breathing, some stretching, because it's like, it's so, even in my own work, when I pop out of my office and I'm like, boom, right into my kids and I'm into my family, I'm into the home, I don't adjust well. So, and I don't have the same level of stress and pain that people are going through as nurses on the, working right now. So I think that is so important. And I'm so happy that you mentioned that. Yeah. So tell us how they can find you.
You can find me on Facebook, Dragonfly Meadows Equine Facilitated Learning, and my website is dragonflymeadows.ca. And if anybody needs to talk about med airs, give me a call or the ACE part, because I will help you. We can talk through it. It's a big deal. I think it's the biggest cause of shame and stigma, among nurses, right? Like, because when you ever come to a new unit, they'll say, "Oh, that's so and so. She made a med air a couple of years ago." Do you know what I mean? That's kind of how it. And that speaks to the whole labeling thing, which we don't need to get into that right now.
Yeah. Well, there is something to that though, right? Like, just being sort of labeled as that kind of nurse, but it would speak the same as like nurses that have taken a leave, right? Like, oh, there's so-and-so, she just got back from a mental health leave. Like that, I mean, it turns my stomach, honestly, that we would have that kind of, like, I don't know if discompassionate is a word, but I think it is. But it's that kind of approach to our colleagues and our friends. Like, we should be supporting people and we should be celebrating people who take action to make their lives better, because it impacts everybody, right? The nurse who's on the floor, who's completely burnt out, who's completely distraught, distressed, depressed, that she's not the nurse that's providing the greatest level of care. She's not the most supportive nurse to the rest of the staff there. The one who does the work, who is willing to take a leave if they need to, or to at least access resources and talk about the struggles. I mean, she becomes a better woman in so many, and I say woman, but I know there's men, but she becomes better in every aspect of her life, right? She is able to do everything to such a better degree. And she feels better. So why wouldn't we celebrate that and really encourage? It's so backward, and it just is really like a symptom of how sick our system is. But
I find that there isn't as much stigma here, at least in the hospital I work with, about taking stress leaves. It's like, I just find it's totally different than when I worked in Alberta. In Alberta, I don't think I knew a nurse that got a stress leave. I don't think I don't know one nurse that took a stress leave for mental health. I don't think they got them, to be honest with you. But here in Nova Scotia, it's been my experience with nurses that have gone off on stress leave. They've been supported and it's been kind of accepted, right? I mean, it's all career longevity.
Yeah, that is so good to hear. I wonder, if like just the bigger provinces, the bigger cities are still struggling with this. There
Yeah.
definitely are nurses that are, particularly this past year and a half, I would say, like
Oh,
where everything has just come to a head. A lot of nurses are off on a leave,
yeah.
which I think is really courageous though to
Yeah.
step up
Me
and
too.
say, my wish is that we would step up and ask for help before it gets to that
Hmm.
point, right?
Yeah.
As a
Yeah.
proactive kind of preventative approach, knowing that this job takes a lot, and that we all need to have that ongoing support. We don't just need to wait until we are drowning and on fire
Yeah.
before we get that help.
Yeah.
We could get it right now. Yeah, you could
Yeah.
get it right now. I
Sure.
so appreciate you and your time, and your expertise and everything that you are doing for nurses and for this profession.
Yeah.
It's definitely needed, and I encourage anyone who's listening to reach out to Jennifer and access her workshops and her programming. So again, thank you so much for
Oh,
being
you're
here.
welcome.
I personally want to thank you for taking your time to listen to this podcast. It is my truest honor to sit with these nurses and witness them tell parts of their story. We as human beings have a deep need to be seen and heard, and this is my way of helping nurses in particular find their voice. Please know that the opinions shared in this podcast are those of the individual sharing them and not a reflection of any employer or regulatory body. We are sharing our truth, and that may not always resonate with you, but I'm guessing if you're listening, that something has rung true for you in this podcast. Our stories offer healing and create connection, two things that we as nurses need as we navigate the jungle of a healthcare career. So thank you for being witness, and if you feel inclined to reach out to the guest on today's episode to offer validation and appreciation, you can always find their contact in the show notes, as well as other links to the offerings of Sandra Payne Wellness. If you'd like to be a part of the community, join our private Facebook group, Surviving Nursing. And if you'd like to share your story on the End the Silence podcast, be sure to reach out. When we can come out of the shadows and into our light, we can create the change that is needed. And when we do this work together, we are so much stronger. Thank you for listening.